I'm Alice. Welcome back to Men Health 30, where we don't shy away from the truths about men's health, especially sexual health. If you're a man over 60 and have recently been experiencing symptoms like waking up 2 to 3 times each night to urinate, a mild burning or discomfort in the lower abdomen after masturbation, decreased libido and persistent fatigue without a clear cause, then don't ignore them. These could be early signs of chronic prostatitis, a condition that affects over 50% of men above the age of 50, often lasting for months or even years, significantly reducing quality of life. And what's concerning is this. The cause may come from something seemingly harmless, not washing your hands before masturbation. Bacteria from unwashed hands can enter the urethra, travel up to the prostate gland, and trigger inflammation, especially at an age when your immune system and androgen levels have already begun to decline. In today's video, I'll walk you through common hygiene mistakes men make after masturbation, and more importantly, a few simple but effective ways to protect your prostate health every single day. It might sound simple, but this is a connection that many men, even doctors, often overlook. Pushpin evidence number 1. According to a study published in the Urology Journal, 2021, 34% of unexplained cases of prostatitis in men over 55 were associated with skin and intestinal bacteria found on their hands. Why does this happen? During masturbation, the skin on your hands comes into direct contact with the glans penis and the urethral opening, areas that are highly sensitive and structurally open. If your hands are not properly cleaned, you're essentially providing a gateway for millions of bacteria to enter your body. The 3 most common types of bacteria include E. coli, intestinal bacteria commonly found on hands after using the toilet; Staphylococcus aureus, skin bacteria that can cause chronic inflammation; Enterococcus spp, gut bacteria capable of ascending infections. Here's a critical point most men don't realize. After ejaculation, the prostate temporarily opens to release semen. This moment is when the gland is most vulnerable. Compounding that, local immune defenses are weakened for several hours after ejaculation, giving bacteria an easier path to ascend through the ejaculatory ducts and reach the prostate, potentially triggering inflammation. Backhand index pointing right, that's why something as simple as thoroughly washing your hands with antibacterial soap before masturbation can significantly reduce your risk of prostatitis, especially as you age and your natural immune barriers begin to weaken. Don't let one careless habit lead to years of urinary problems, pelvic discomfort, or declining sexual function. Start with the most basic and powerful preventive step. Wash your hands properly. The older you get, the higher the risk, the biological explanation. Many people still believe that prostatitis is caused by cold exposure, sitting too long, or poor eating habits. But the truth is, even if you live a healthy lifestyle, once you pass age 50, your body naturally becomes more vulnerable than ever before. Pushpin evidence number 2. According to the National Institutes of Health, NIH, men over 50 begin to experience 3 key biological changes. Reduced androgen, testosterone levels. This weakens the body's natural immune defenses in the urinary tract, the first line of protection against invading bacteria. Decreased urethral secretions. Makes it easier for bacteria to adhere to and penetrate the urinary tract, especially after ejaculation. Benign prostatic hyperplasia, BPH, slows down urine flow and causes fluid retention, creating an ideal environment for bacterial growth and inflammation. Backhand index pointing right, the result? Even a small number of bacteria, such as from unwashed hands or improper hygiene after masturbation, can trigger chronic inflammation in the prostate. Round Pushpin, a study published in the Journal of Men's Health, 2020, involving over 1,200 men, found Men over the age of 60 are 2.3 times more likely to develop chronic prostatitis if they have poor genital hygiene after masturbation or sexual activity. In other words, the same amount of bacteria that your body could easily fight off at 30 might overwhelm your immune system at 60. That's why even small hygiene mistakes become major risks as you age. Backhand index pointing right, and this is exactly why proper hygiene, even something as basic as washing your hands, becomes more essential than ever. You might have chronic prostatitis, CPPS, without even knowing it. Not all cases of prostatitis are caused by bacterial infection. A common, yet often overlooked, form is chronic pelvic pain syndrome, CPPS. The danger? Its symptoms are vague and can easily be mistaken for normal signs of aging, leading many men to suffer in silence for years without ever receiving a proper diagnosis. If you're experiencing any of the following: waking up 2 to 4 times at night to urinate, weak urine stream, or a feeling of incomplete emptying, heaviness, pressure, or tension in the pelvic floor, dull aching pain between the anus and scrotum, decreased sexual pleasure or unsatisfying ejaculation, then you may already be living with CPPS without ever knowing it. Pushpin evidence number 3. According to Cleveland Clinic, 2022, 70% of men over 60 who sought medical help for urinary symptoms were later diagnosed with undetected chronic prostatitis. Most had never heard that washing hands before masturbation could be an important preventive factor. Unlike acute bacterial prostatitis, CPPS often develops from small, repeated issues that build up over time, such as weak bacterial infections that are never fully cleared, improper genital hygiene, ejaculating in unsanitary conditions, or after holding urine for too long. These factors lead the prostate into a state of low-grade, chronic inflammation, not sharp or urgent, but persistent enough to cause pain, fatigue, and gradual decline in sexual function. Many men assume this is simply a natural part of aging. But in reality, a significant root cause may stem from simple, avoidable hygiene mistakes, like not washing your hands before masturbation. Prevention Guide, based on medical recommendations. If you've always thought post-ejaculation hygiene was just a personal matter, this is the time to rethink. Pushpin according to the American Urological Association, AUA. Men over the age of 50 should treat post-ejaculation hygiene as a vital medical routine, especially to help prevent chronic prostatitis. Here are 5 simple steps that can make a big difference. Small blue diamond 1. Wash your hands thoroughly with antibacterial soap for at least 20 seconds. Backhand index pointing right, don't just rinse with water. Wash your hands as if preparing for surgery. Palms, between fingers, and under the nails. Small blue diamond 2. Gently clean your genital area with warm water and dry it with a clean towel. Backhand index pointing right, avoid using wet wipes with alcohol or fragrances. Lightly clean around the glands and skin folds, areas where bacteria tend to accumulate. Small blue diamond 3. Urinate after masturbation. Backhand index pointing right, the urine stream helps flush out residual bacteria from the urethra before they can migrate upward toward the prostate. Small blue diamond 4. Avoid putting on damp or tight underwear. Backhand index pointing right, moisture, sweat, and leftover fluids create a perfect environment for bacterial growth. Opt for breathable cotton underwear and change into a fresh pair after each ejaculation. Small blue diamond 5. Monitor your symptoms and don't delay seeking medical attention. Backhand index pointing right, nighttime urination, burning sensation, or pelvic pain aren't just signs of aging. They could be early warnings from your prostate. If you've stayed with me until this moment, I believe you no longer see this as something minor, because sexual health, especially for men over 60, isn't just about sex. It's about sleeping better. It's about starting your day with confidence. It's about feeling in control of your body again, and sometimes it's about the peace of mind of the one you share your life with. And sometimes it all begins with something as simple as this: washing your hands, practicing proper hygiene, and listening to your body. I'm Alice. Thank you for spending your time here with Men Health 30, where we face the truths about men's sexual health that few people ever talk about openly. If you found this video helpful, please hit like, share it with a man you care about, or leave a comment below. I read and appreciate every single one. In the next video, I'll reveal a daily habit that many men maintain without thinking, one that seems harmless, but quietly lowers testosterone, reduces libido, and speeds up the aging process. I'll see you there, because it's never too late to truly understand and live in tune with your body. You deserve a complete, vibrant health from the inside out.